Okay, y'all know that. Okay, so let's do, I want to say something about this one, because I remember this and this in the same person. How many of you know that patients, older patients especially, know when they have cancer or they're going to die? You guys know that? They do know, they just don't tell anyone. Back in the day, you didn't talk about these things. Y'all know that? Y'all know that? Okay, your grandmother don't want to sit and converse about nothing about her body. Okay, I'm going to tell you that right now. We be all up on Facebook. What it mean when your coochie look like this? Please. Okay, that's not how they got down. Okay? Hopefully you don't get down like that either. But people be on Facebook sharing all kind of crazy. Your grandmother didn't get down like that. So whatever was going on with them stayed with her. Her husband didn't even know. That's what this patient was all about. So I have you guys come in, you come in for exams or whatever you're doing. So I train my staff, because y'all crazy, to ask, why are you being seen? Because something that y'all have a habit of doing, and you just can't stop. I don't know what your problem is, but I think it's because you were at work when you called me. You call for an appointment with the OBGYN, with Shelly, and you say, when my receptionist asks, what are you being seen for? Oh, I need a, because you don't want nobody at work to know. So she says, baby, I can't hear you. Can you just tell me what you say now, honey? Itchy. Oh. Okay, all right, so we'll put you down, okay. Then you do something else crazy. You call, and if you really don't want to say nothing at work because you're in a cubicle society, you say, Pat, I just need a Pat. Because you think every time you go on your coochie, it's a Pat. I need a Pat. Okay, well, baby, you had a PAP. It says here in the computer you're all nice and normal. You had a PAP about 3 months ago. But I need another one. Oh, okay. So now I train my staff, since y'all want to call me up and lie every day. I train my staff to just ask you when they see you in the privacy of the exam room, what are you seeing Shelly today for? And that's when you get the real truth. This lady blew my medical assistant's mind. She told my medical assistant when she asked her, why are you seeing Shelly today? Because I have cancer and I know I'm gonna die. That's what she told my medical assistant. My medical assistant ran out of that room hysterical. What makes this the worst is that I had all 3 of her grown-up daughters as my patients. And they're the ones that sent her to us. And they said, and I quote, Mom was traumatized with her doctor that delivered us. So we need somebody really, really gentle and fun. So we're going to send her to you. Because she hasn't had a PAP since she had me. And the me who said that was 31 years old. She hasn't had a PAP. Why? Because she was traumatized. She was traumatized by the OB that delivered all 3 girls. He traumatized her. Now, I don't even want to know what kind of trauma that was. But in this Me Too era, I'm afraid to ask. But he traumatized her. She couldn't wait to get away from him. So after she had her baby, she wasn't going back for shit. She didn't need no pills. She had the tubes tied. Leave me the fuck alone. That's trauma. I see that in more older people than I care to report. So what trauma did she endure? Because you're hearing stories that I just can't fathom. Out of all these crazy-ass powerful people out here, women and men abusing people. Just really unbelievable, isn't it? Just you'll be like, for real, y'all? Damn. Every other person look like. So I don't want to know what happened here, but I can imagine. So it caused her not to ever go back for care. Well, we know that one of the number 1 reasons for cervical cancer is that you haven't had a PAP in the last 7 to 10 years. So when she came in and that medical assistant flew out of that room and came up to me scared to death, Shelly, this is really weird, and I'm really scared, and it does look like she's really small, but the lady in room 4 said she's here because she's got cancer and she knows she's going to die. I said, oh, God, okay. Let me go in here and love on her. I get in the room. She's very clear. Now, look, I'm here because my daughters really wanted me to come, but you can't tell my daughters and you can't tell my husband anything. And this is the era of HIPAA, of course, right? So there ain't no way I was going to tell them anything anyway, right, guys? But I get in there, and the discharge is so copious, that word, it's so copious, that when I put the speculum in, it's flowing onto the floor. The cervix itself had already prolapsed and was completely necrotic and black. I'll never forget it. Had nightmares for years. And indeed, she did die within 2 months. And I was sworn to secrecy, couldn't tell them. Only way they knew was on the actual death certificate. They didn't hold it against me. They were just blown away that she lived with that. And they really hate that doctor who's still doing business. Thickening, lump, or mass anywhere. Those of you who were here with Maggie, Margot Edie, my baby from my class, came in and shared with you her story about having Hodgkin's. You know that she had a painless mass in her neck. She told you that she had this weird kind of mass, and she remembers being in my class learning that painless masses, unless they go away in 4 weeks, they are not to be trifled with, they are to be followed up. And so her very first day, as you may recall, at one of the local hospitals as an RN, her very first day in the ER as a brand new nurse, she was told that she had Hodgkin's lymphoma. So she is about to have that baby that she found out she was pregnant with when she talked to you guys.
Yes.
She was about 4 months then. She's due any minute now. She wants to work with us on the west side. I said, girl, just had a damn baby, okay? One thing at a time, girl. But we fell in love with her. We were in tears that day. But yeah, she's going to have a baby. So her mass was in her neck. But if you're smart, you're making sure that any 12-year-old young men you know are getting taught to check their testicles, right? Testicle self-exams in the shower, right?
Yes.
Every month for any masses which would feel exactly like a rock. Be real savvy about this when you talk to your sons. Make sure they know it feels like a hard rock. It is not normal. They need to check every single month in the shower. Same day of the month would be a great idea. Start at 12 years old. So I went home one day after teaching this lecture. I don't know, it's been years, of course. I said, Charles, you making sure you told those boys to check their testicles in the shower? And like I always tell you, you walk by the room, hey! While you're there jacking off, check your balls. Charles, you didn't say that to the boys. Oh, they know I'm playing. My girls were mortified. Oh, God. What did you say, Mommy? Okay, we're not going to talk about it, baby. Yeah, so let's do it a little bit more tactful than that. Tell your sons to get on it here. Okay. Also remember that the lump that they may feel, this hard pebble-like structure that is just hard, it won't hurt at all. It'll be painless. I keep telling you, a lot of cancers are painless, ain't that right? Now another issue when it comes to this patient is the thickening issue, right? The thickening lump or mass, all of that, right? So I told you I know somebody with all of this. I can see their faces. My patient called me. She had had a normal mammogram in October. She was calling me in January to say that she knows for a fact she feels a lump. Well, I'll tell you what. I don't believe machines. I believe human beings, especially my patients because they're extremely educated. And so we said to her, come on down to the Price is Right, girlfriend. You said the right magic term. You said lump. So I walk in the room, and I've always told my patients, don't tell me where it is, let me find it on my own. And I give her my spiel about the whole ultrasound, mammogram, breast surgery. And she's like, okay, no problem. She goes, but you think I'm crazy, don't you? Because, I did have a normal mammogram. Doesn't that matter? Like, girl, please, it's a test. Shit, all tests can fail. So I'm glad you're here, and you should pretty much pat yourself on the back. Let me see if I can find it now. Now I go and I try to examine her. I have her sit up, I have her stand up, have her bend over, have her do all this shit, can't find a damn lump. What kind of shit is this? I said, girl, I give up. I cannot find this lump. And I did it twice. Sitting, standing, bending, all this crap. I said, no, I'm going to have to give in on this one. I need you to show me where this lump is. She pointed smack dab in the middle of her breast. And it was the size of a sweet pea. And because she pointed to her smack dab in the middle of her breast, it made sense why the mammogram didn't pick it up. Because the mammogram goes whoop, whoop, whoop. It ain't did shit right here. This was breast cancer. I will never forget it. I thank you, God, that I had her come down and I didn't believe a stupid test. Because the patients are always right until proven wrong. Okay? She's healthy as a fiddle. She came back with her little grading and staging that we're going to go over. Stage 1, grade 1, I mean, nothing. Got the damn thing removed, no chemo, no nothing. That's my boo. Ride or die. So, I mean, really, educate these patients. Just tell them, girl, whatever it is you feel, come on, honey, let me figure it out. That's what you paid me for. I was so proud of her. I really was. So was the doctor. It's a good catch. Got it before you needed any other drama, okay? So just don't doubt yourself. Let's get it early, okay? Indigestion or difficulty swallowing is the most subtle thing on my board right now. There are plenty of you who have heartburn. You go buy your over-the-counter Prilosec. Perhaps you go to Sam's and get the big-ass box of everything in it cheap. I don't know what you do, but you need to stop. Because the only length of time you should be using any kind of PPI or H2 antagonist, which is your Zantac and your Tagamet and all that shit. PPIs are your Pepcid and your Prilosec and your Nexium and all that shit. The only time you ought to be using that shit long term is if you've had a GI bleed. Otherwise, keep it to 2 weeks and get your shit checked out. Stop blowing off heartburn. GERD, heartburn, reflux, whatever fancy name you want to give it, should have been worked up. It should have been worked up with an endoscopy. None of this, oh, it's just a little heartburn. And if you're tiny and you keep having heartburn, that's really outrageous. Because tiny people don't have heartburn. At least if you're obese, you can chalk it off as to, okay, if I lose the weight, I'll get rid of this heartburn. So I can guarantee you that bariatric surgery patients don't have heartburn anymore. Because it was all about the weight in the first place. Okay? So understand that heartburn is going with obesity, but you still should make sure you get it checked out. What does get it checked out mean? Well, it depends on your age, your stature, your weight, your history, your family history. It depends on all that. But to truly get it checked out in a way that will soothe everybody's nerves, they may have to do an endoscopy. They may have to do an endoscopy. Okay? Just depends on what's going on with you and your history. Now, so I always tell you, I know everybody with each and every one of these. Had a beautiful nurse that worked with, not with me, but she worked upstairs. I worked in labor and delivery. She worked in women's health upstairs. So all of our floors, we had like 6 or 7 floors. And so she worked on the floor where people got hysterectomies, mastectomies, women's health, right? Surgical really, but you know, so she worked up there. So she would come down to my floor, the 2nd floor, and she would get, back then, you know, I'm old. Back then we had like big freaking unit doses of Mylanta, Maalox, all that shit. She would come down and steal the Maalox or the Mylanta or whatever was in the cabinet. So when she came down to steal the Maalox or the Mylanta or whatever was in the cabinet, she did this probably about, I don't know, man, about 2 weeks in a row. Like she just kept asking, could you borrow, you know. I said, what about, hold up, shit. What the fuck is you doing with it? She's drinking it all the way up the stairs. What are you doing with this? Why are you on this? She said, it just feels better. I got really bad heartburn. I said, oh, hell no. You need to get that shit checked out. People say that's my favorite last words. You need to get that shit checked out, right? She did. It was pancreatic cancer at 26. I can see her face, her hair, her expression, her white scrubs. I can see it all there. I'll never forget it. She was 26. She was stealing Maalox. That was her only fucking symptom, heartburn. She's gone. Don't ignore heartburn. Another girl in my class, she still thanks me. It wasn't cancer, but she was ignoring it and coding it with Maalox and Mylanta and all this for shit, Tums or whatever else. And so she's like, okay, you scared the shit out of me. I'm going to get checked out. It was a massive hiatal hernia, And as soon as she passed it, and you can sit there for for a minute with that. As soon as she passed it, she got it removed, she didn't have another day of heartburn. She feels so good. You don't need to suffer. Something's wrong. Get it checked, okay? Your body is trying to tell you something with all this shit. Now, difficulty swallowing, that feels like a lump in your throat. It just feels like a lump in your throat. Esophageal cancer. Feels like a lump in your throat. Okay, so heartburn or indigestion could be pancreatic cancer, esophageal cancer, or stomach cancer. Difficulty swallowing could be pharyngeal, laryngeal cancer, either one. Esophageal as well. So pharyngeal, laryngeal cancer, and I don't have esophageal. Don't ask me why, so I'm going to put it on here. Or esophageal cancer. Esophageal. I don't think I have it. No. Okay, so I want you to know those three, huh? Again, a lump in your throat, pharyngeal, laryngeal, esophageal cancer, indigestion, stomach cancer, esophageal cancer, pancreatic cancer. Okay? Now the next one says obvious changes in a wart or a mole. Skin color, I added. So obvious changes in a wart or a mole. Now skin color is a little deceiving because even though I added that, I want you to know that elderly patients can have brown spots and skin tags and be perfectly fine. But this is like some crazy stuff because what's going to happen with these changes in this wart or this mole is number one, and I don't use this as an absolute. Who has a pencil? Anybody? With an eraser on the edge there? What's the eraser, child? Yes. This is one of the traditional pencils I grew up with. You got a traditional pencil. You got a fancy shit. This child got a mechanical one.
That's the only one my kids will use. I have mechanical. I'm sorry. They don't have to get the sharp.
Thank you, old school player from West Side. Thank you. Listen, when I see my patient, and they come in there for their little oil change, and they boob and they lube job, I look at their little marks and things. If I see them, I ain't trying to look for them. That's a dermatologist. But if I see them, I do just like this. Yep, biopsy bigger than my eraser. Yep, biopsy bigger than my eraser. Let's go roll with a pencil. I keep a pencil in every family. Biopsy. Okay? Because I'm dead serious. You know what that E is for on that skin cancer chart up there? That ABCDGE shit? That's for eraser tip, as far as I'm concerned. It really means evolving, but Joe has to remember eraser tip. It's bigger than eraser tip means biopsy. Bigger than an eraser tip, it needs a biopsy. So one of y'all called me years after you didn't graduate out of class. Hey, Miss Shelley, I don't know if you remember me, but I need a letter of recommendation. My name is so-and-so. I used to sit at the table over there by the window. Yeah, I remember you. I remember everybody for the most part. Just come to toe-to-toe. I know you real well. So she came toe-to-toe, so I knew her real well. So I said, okay, listen. Before I write this old crazy-ass letter of recommendation, let me ask you something while I got you on the phone. Did you ever get that mole biopsy that was on the back of your neck? I can hear it on the phone. Silence, complete silence. You remember that? Hell yeah, I remember that. Did you get it checked? You know what? I've been so busy. I ain't writing shit. Till you bring me proof that you have an appointment. Dang, you don't be playing. That was 5 years ago. No, I don't play. Because I love you. I don't want nothing bad to happen to my babies. It makes me sick when I hear something bad happen. Because I fell in love with you. I can't help it. Come toe-to-toe, I really love you. Because that's a badass bitch that came to toe-to-toe. I mean, my God. Who comes in toe-to-toe? Nobody but the best. So yeah, I love you. Don't do this. Go get this shit checked out. Get it checked out. If it's bigger than an eraser tip. Now, so I have my little baby. She is going to have a beautiful child, and it's her first baby. She's gorgeous. Green eyes, though. Freckles. She's an African-American woman, but she has lighter hair. And so she's going to have a baby, And you know that as a provider, I'm supposed to be very excited when a baby is born, and I am, because I feel like God is in the room, except for this Sunday because I have plans. So when she called me and told me her water break, I'm like, in the background, fuck my life. I don't want to go to the hospital. So I can't sound like that with her, so I'm like, oh, that's so freaking cool. Okay, time for a birthday party. Let's go. Sent her down to the hospital. I go down there, and the reason why, you have to understand my life, the reason why I was so upset is because we were watching at the time Top Model. Who remember Top Model? Anybody remember Top Model? Okay, good. It was the grand finale. Me and my two daughters, one was at Spelman, we were supposed to be talking on the phone on the commercials, one of those Skype and shit back in the days. So she's at Spelman, we agreed to talk on the commercials about the show. The other little baby was in the house still. She's a baby. I mean, she, 11 years apart, so she's still a little girl. So we sit on the couch together, got the chocolate chip cookie dough batter. Remember the dough? We eat the dough, right? We bad mother. And then we got the little chips and shit. We're about to have this finale. Damn patient called and interrupted this shit, talking about her water broke. So I gotta go down here and act like I care. So I do. So I love her and I'm there. Okay, let's go. Now, she made my day. She did. When I got down there, she was like, Shelly, I'm so upset. My water broke and I really don't want to be here. I was about to watch Top Model. I'm like, for real? Yeah. We can do this. Epidural, right? Yeah, that's what I'm talking about. So she already wanted an epidural. We gave her an epidural. She was calm, cool, and collected, contracting every 2 to 5 minutes and doing really well in her active labor. Came there 5 centimeters. God is good. We watched Top Model, and it was the season that Eva won. Remember that spider across her face? She was scared to death. Gotta go way back. Okay, now, so she won the Top Model. The show is over. I look at my patient. Okay, the show is over. Feel like I get a push? Feel any pressure? She was like, girl, I was thinking the same thing. The show over. Let's get this over. I said, that's what I'm talking about. She said, I've been sitting on the baby's head, I think, because I just want to see what's going on. I said, oh. So I checked her. She was 10 centimeters. We had a baby. Now, I ain't going to lie to you. We family, right? We can say this stuff together. All babies are not cute. No, I ain't gonna tell that lie. All some of them babies ugly as hell. But this baby was gorgeous. The prettiest thing I ever seen. I'm talking about like a little angel dove. I said, oh my God, so cute. You know why? Because she ain't push long. She was sitting on the damn baby's head. She wanted to push him for 2 minutes. When you push for 2 hours, they call them heads. They're ugly, y'all. They're ugly. This baby was cute. Cute as a button. So we went on about our business. I didn't thought no more about that child. She came for a 6-week checkup, left for a 6-week checkup. Okay, so I didn't thought the number. She calls maybe 10 months later. You probably don't remember, but do you remember when you told me about 6 weeks checkup that I need to get that shit checked out and that mold that I had on my knee removed? And then when she started talking, I do remember the mold. It looked like this. It was warty looking. And it looked about as big as that, more kidney shaped though. More like a kidney. Okay, but it was, that size. Is that bigger than my eraser tip, everyone? Hell to the yeah. So it was on the inside of her knee. I told her, what? What are you doing? Get this off of you. She said, I know, right? Okay, I'm going to get it checked out. She did not. She waited a little while. And then when she did, she went to the most popular dermatologist in this city. And you are not going to say his name, please. He is an African-American dermatologist. He took care of almost every African-American in the city. He gave everybody the same appointment on Saturday. You got the same ointment. Now, she went to him to tell him about her lesion. And he said, and I quote, well, now you're a young girl. You don't need to worry too much about this. African-Americans don't really have to worry about skin cancer, and that was many years ago. Now we know better. And she said, okay, so she kind of ignored it. And then started bleeding. Changes. Started bleeding. That's what all three. So it would heal up and then get back again. It would start bleeding, mess up her cute white pants in the summer. It would stop bleeding and then later down the road bleed again. She was sick of it. She's like, Shelly's right, I gotta get this shit off me. So she goes to another dermatologist who looks at it for 5 seconds and says, this is going to come off. I need to do a biopsy. Isn't that what I told you when we started is the only way to diagnose? Yes. He did a biopsy. It was the worst, the most aggressive, the most invasive melanoma I have ever seen. Since or then, I've never seen anything like it. She had her entire leg carved out. She had grafts pulled from her bottom and her chest to patch up that horrible spot. She had the chemo. She had the radiation. She had all that shit. And then she called me and said, and I'll never forget it because it's been about 5 years. She said on a cold January day, hey, Shelly, this is so-and-so. Well, they said there's nothing else they could do. And I refuse. I'm kind of like an eternal optimist, so I really don't understand what the fuck you're trying to say at 27. So I said, what is you talking about, child? You know how I get with y'all. I'm like, what the fuck you want? Like, leave me alone. What you need, honey? You want the office open? You gotta come to work more. What is you talking about? Because I ain't clicked. I didn't click that she's talking about the doctors are giving up. That didn't click. I said, what is you talking about? Yeah. They said there's nothing else they can do. And then it hit, I'm like, she talking about her cancer? Because she was still my patient. I mean, I didn't think about her cancer. I know she's going through a lot, but she's 20-something years old. There's nothing else they could do because they have done everything and just keep coming back. But don't worry, Shelly, don't worry. I got a plan. I'm going to go to Australia, to that cancer center there. They got a lot of really, really good things that they do, some advanced therapies. Don't worry. I was calling because I'm trying to just get the collection up for the plane ride. Oh, baby, come get some money. Come on. Come on, get it. I gave her God knows how much. And then so she was planning to go to Australia to do whatever it took to live through this cancer. But then she called me in April. In April, she called me crying, incoherently speaking, but through her tears I could hear her say, this motherfucker done gave me some shit. And I said, oh my God, what do you mean? Shelly, I'm in so much pain. I got a fever, I think. I mean, I'm shaking. I don't know what the fuck is wrong. I got pelvic pain, like I can hardly walk, Shelly. I said, oh, no. When she came to my office, I could see this right away, trichomonas, right? That's seen on the microscope. I could see that just with a little bit of saline on the slide. Boom, I saw that. These I can't tell till I test. But once you have this, what do I teach you? Wherever there's one STD, you test for all of them because there's no doubt going to be some more. And it was all 3. Now, think it through. Can I give that precious baby a shot and some pills and we say, bye-bye? No, because what type of patient is she? Immunosuppressed. So what I had to do is admit her. This was not going to be a shot and some pills and that. This was going to be admission to the hospital. I'm going to call infectious disease consult. I'm going to get oncology in on it. You're going to need pain management because you need a PCA with this type of pain that I can't hardly touch you for. And as I sat by her side in April, I saw her go through the whole bargaining part of grief and beg God to let her live to see her daughter's first day of kindergarten. I saw that she was in so much pain that once we had the PCA set up, she was in a little less pain enough for me to examine. She had a big ass abdominal mass. It was pancreatic cancer metastasis to the pancreas. And I saw her again beg God, just give me to the first day of my baby's kindergarten. And she died 2 weeks later. She died 2 weeks later because I told you, no condoms. Every single one of those are preventable with condoms. You see, cancer does not kill you, infection does. The number 1 killer of the cancer patient is infection. Her sister, also my patient, took a picture of her daughter's first day of kindergarten, rolled it up in a balloon that she blew up and sent it to her sister. An African-American 28-year-old woman lost her life for no other reason than condoms and lack of early diagnosis because of stereotypes. Truth be told, her mother is Irish. So that was just dumb all the way around. Okay? Now, so what I am telling you is that I can put a face with every single one of these people. And you will too, because you're a nurse. And you will know when you look at this, every little patient is not just it. Let's try another one, the last one. It says, nagging pain, cough or persistent hoarseness. Persistent hoarseness. You see, our tea should not be sounding like uncle. Y'all, come on down, eat now. Dinner ready. What the fuck is that?
I'm about to write this.
Y'all already know. We know people like that, man. I know people that wake up and for the first 2 hours of the morning they doing this. They're all smokers. Every last one of them. First 2 hours of the day. Why are they doing it the first 2 hours of the day? Because they slept on the irritating tobacco, carcinogen causing nicotine and tar. And it built that phlegm because you see, one of the things that your body does when it's got an irritant is it tries to build the phlegm around it so you can cough it out. 2 hours every morning. There's a company locally, they hired me, I should say, as a consultant to come in and clean them up and make them ready for Medicare approval. And so I come into the company, I had a nice company, I didn't have to do much, it's great money for nothing really. But I had to go in there and do the little cleanup, okay, do this better, do that better, change this. So when I get there to the company, there's a husband and wife team, they're adorable. And the wife spends the first 2 hours of the beginning of every day coughing like that. And I have been very clear with her that I don't like it. I think you need to go be evaluated. This is not normal. I know, Shell, you're always yelling at me. She goes on smoke break at least 3 times in the middle of the day. It's not cute. It's not good. It's not going to be good. And I know it. Okay? Because I already know what that sounds like. I can tell. I listen, I don't know about you, but my husband likes, Trevisano on 1100. If you're a guy, no guys in here today, guys like that channel. But he's going to have something because he sounds exactly like everybody I know that has something going on. And he admittedly smokes a lot and won't stop. So yeah, this is what you sound like. God forbid you cough up blood. Make sure you know that's hemoptysis, right? Mm-hmm. That is a very late sign of lung cancer. Very late sign of lung cancer. But that hoarseness and that coughing in the morning and all this hot ass mess. I put nagging pain because this is not specific to a cancer. This is specific to the fact that all cancer has the ability to spread. And when it's spread, it may press on something around it and hurt. Because most cancers in and of itself, the organ with the cancer doesn't hurt. But once it starts spreading, it can cause pain, a nagging pain, I would say. Something where you go, what the fuck is going on? I don't know what's wrong. Something is not quite right. It's nagging. Okay, so that's when it's spread. All right? Okay, so you got it, huh? You got your